So COVID-19 infection numbers are rising all across the country. Long-term care facilities that already got hammered by the virus say they're bracing for a third wave as we head into the cold winter months. Caitlin Ross talked to care providers about what they're doing to get ready.
They're watching those numbers very closely because the number of people infected in any community directly impacts the number of people infected in those long-term care facilities.
If COVID came into one of our care homes, it would kill all of our residents. I mean, we cater to very high care need, high acuity residents. They can't get the flu. They sure can't get COVID.
Senior care expert Brian Levy has been worried about the COVID-19 pandemic from the start. He manages a long-term care facility and says he's been watching how the virus gets into their homes.
COVID really came from family members and caregivers. So, it's our responsibility to monitor our staff, to adjust schedules, to make sure that the least amount of people are coming in and out of the homes.
That's backed up by the National Healthcare Association, which recently released a study about a possible third spike of the virus inside long-term care facilities. The executive director of the Georgia chapter says our state is actually in a better position than most.
We're very fortunate right now that in the state of Georgia, unlike much of the rest of the country, we actually are not seeing a significant increase in cases.
Our own data backs that up, with the number of positive cases in long-term care facilities trending down week after week. But Tony Marshall says the current numbers cannot predict what will happen this winter.
We're particularly concerned because everybody's getting tired. We've gone through an extended period of time where people have been isolated, where people have not been able to meet, where we've not been able to go out and eat like we normally do. And we're afraid that people will be complacent.
The National Healthcare Association is advocating for the federal government to pass another relief bill for long-term care facilities. The money allocated from the CARES Act in March will run out by the end of the year. What they say their most urgent needs are to keep residents safe coming up at 6.